We're going to have Rosemary Piccolo come up here, and she's from the clinic in up there in Connecticut, New Haven, Connecticut, and she's been using the program for 2 years. She's a medical doctor. Dr. Piccolo is the head of the organization, and she's had a lot of excellent successes. And she's basically just gotten into the infrared a couple of months ago, 2 or 3 months ago, but has been using SAF, the chains, different kinds of Okay, give her a big hand, please.
I just wanted to say, how pleased we are with the whole system. We've had the system going, and we started out with it without a computer, doing everything by hand, and have progressed to using now quite really using the infrared. And I also would like Tim McCarthy, who's one of the best clinicians in the world, I think, works with us. And we have quite a good team now. We now have 3 doctors working with us. And a couple of Jean Ann is here, my husband Jim, and I are co-directors of the center. And we're just, expanding by leaps and bounds. We have 2 other people besides that in the building now. The successes we've had are way across the board, types of conditions, age, it's just all over the place, and there's just too many to talk about. But maybe Tim would be kind enough to give us a couple. I like the way he tells them better than I do. But I have to tell you my own personal experience, because Jim and I were in a major car accident just 2 weeks ago. We passed by him 2 weeks. So, and Jim has pictures of the car accident, and how he took me out and dragged me out of the car, and how the car crushed right down on me, and how I seeing things going. It was amazing. But I appreciate life ever so much more having been through this. And Tim and Dr. Piccolo, it was very funny. I have to tell how this happened. The accident, they were hit by a gasoline tanker, and part of the tanker went right over the car, and it dragged us about 30 feet. And my husband managed the car very, very well, got us off the road, opened the car door, and took me out. I got in the ambulance. Well, the whole thing began to be quite a scenario. And I got to the hospital and was unable to move, and was on the stretcher, and called for Jean Ann somehow, and came to the hospital. And they wouldn't even let her near me. Glass in my eyes, glass all over the place, mouth, hair, ears. So I said, Jeannie, and I'm going to shout out numbers to you. These are the probiotics. I said, you'll know what I mean. So I'm shouting out, 58, 20, 17. She's 10 feet away, so she communicated with Dr. Piccolo, whom we had just left at the office, and he, being only a few blocks away from the hospital, came right over with homeopathic, and we tucked him under the sheets, so I'm taking homeopathic right from the beginning. And later, I had a concussion, so they kept me in the hospital a week. And they finally realized on about the 5th day that they really weren't doing anything. I had not taken one thing from the hospital. They had tried to give me things, but in the emergency room they said, are you allergic to any drugs, any medication? I said, yes, I'm allergic to all of them. I said, if you give me any, I will be far more ill than I am now. So they must have put that on my chart. I finally get to a room, and the nurse said to me, what is this holistic religion you're involved in? So right away, But then I decided as I was I was kind of doing a study on what the hospital was about, and just watching everything as it was happening, and trying to, defend myself against these things and observe at the same time and integrate all of this. And I just came along really well. So about the 5th day, the doctor said to me, he says, I finally realized you're using this as a hotel. Which is true, because the staff was coming up for staff meetings, and people were just coming right through, visiting and everything. So I walked out on Thursday out of the hospital, right over to our office, and Tim did an infrared on me. And we had comparison tests on the blood work in the emergency room. I had blood work done as I left the hospital. So we're going to be running those. But Tim ran programs on me at least every other day while I was in the hospital, changing the homeopathic. And the improvement was amazing, really amazing. So I just wanted to tell you that. And I wanted to, if Tim, would you mind just sharing a couple of people from the center? I mean, we have so many people we've put through this program at this point. Health Dynamic Center. We have a couple of brochures with us.
Well, there's so many, like Rose says, there's so many stories. Since I've been working with Health Dynamics and with the Life Energy Program, I don't think there's been a day that has gone by where there's been some revelation. And what's intriguing about the whole thing is that it's not so much happening to the patients, or I use that term in pejorative, but it's not so much what's happening to the patients, it's that it's happened to you too. So a block you may have, you think, well, this person cannot really be treated by this concept, or this program. That's your concept. That's as much as your block as their block. So every day we go in there, we find something different. Even the same people coming in, we find that they're different, we're different, and we can't. It's very hard to say what is changing, but you know something is changing, and it seems to be changing towards positive. One story that's been coming to my mind a lot recently, and I forgot it for a bit, but it was just amazing. We had this woman that came in, and I was assuming that she was either had intense psychological problems or was a deaf mute, because she didn't say anything. She just sat there. She wouldn't make eye contact with anybody. And she came with a gentleman who was, he looked about 65 years old, and I assumed, we all assumed that was her husband, and it turned out to be her father. She looked about 15 years older than she actually was. So we soon found out that she was the daughter, and that her problem was that she had a lot of various medical problems, but she was reclusive. She's been in a house, I guess, for years, and she doesn't talk to anybody, doesn't communicate with anybody other than her father. So we started running a program. I was only working with the Life Energy Program for about 3 months at a time. And, I have to admit, each step along the way I was very skeptical, because it just kept challenging me. Just challenging, saying, well, I can accept this, but, this one is a little too far, a little too much. So I'm running the SAF on this woman, and I'm asking, up to that time, every time you ask questions like, what happened to you when you lose somebody when you're 13 or 14, it always was this. It always was this. Yeah, that happened, this and this. Well, for some reason, it was not hitting with this woman. And I was saying in the back of my mind, saying, well, this program doesn't work. I guess, it just works for some people and so on. So I kept asking questions. Then I noticed that every other question I asked the woman, her father was answering the questions. And so I kept politely saying to him, we separate people now, but we got to learn this. I kept going back to her, let her answer. But then I kept getting trained towards what the father was saying. So I almost stopped looking at her, and I'm talking to the father, and he starts talking about his deceased wife. And I started asking questions about the deceased wife. When she died, when she had heart attack, stroke, there it was on the SAF. He was helping her fill out the SAF. And so he was imprinting, his change on his daughter. And his daughter was acting like a surrogate wife. It was like Alfred Hitchcock would have loved it for a new movie, It would have been beautiful. And so we were, Rosemary, before we had the infrared system, and we continued to use it, we were using kinesiology to test the remedies. We got up and we were testing on the woman. The father steps up behind the testing and falls back all of a sudden. He says, could this affect me? What you're doing, it was just the muscle testing, but he obviously was in the field. So I remember the brilliant remedy that Rose prescribed for that situation. Like, she had to get out of the house like twice a week. That was
it was just so obvious.
Plus
she had no life. She just had no life. It was all revolved around him, and had revolved around her for both of them.
So they come in, there's 2 more sessions after that, and Rosemary saying to the father, have you noticed any change in the daughter? And he was literally jumping off the ground going, change! He's saying, like, you've given her back her life. He had no idea that he was part of the anchor into her. Now, this is the type of situation I would think that a psychologist or psychiatrist would take, if they got to the bottom of it all, would take 6, 7 months. But on the SAF, it's like you're given the whole map. And it's the person's, I guess, subconscious or whatever, is giving you to say, here's what happened to me, and here's how I want it unfolded. Here's step by step. It's so easy. In fact, I found that the more I stay out of the action as a monitor on a program, the more I just sit back and allow it to flow, allow them to unravel the whole thing, the better it works. I used to think I had to, put my 2 cents within all the time and interpret it, but that was my program. And so I'm discovering a lot about myself. I mean, this is an understatement, but as I'm doing this situation, I'm starting to see. But this is, believe me, this is just one story. We have something of that magnitude and quality daily at the center, and it is just, and see, we're all. What's beautiful about this too is that we're running programs on ourselves at the same time. So you're seeing it happening in you. You're seeing it happening on the person. It's true. Like by that definition, it's truly holistic. It's truly integrative, and you start changing your attitude towards people and the universe and the environment.
I just want to give one more. We had a man come in, and this is one that Tim and I joke about now. Tim was quite new at it at that time, and he came in and he was really in bad shape. 2 canes, walking, hardly making.
Those names.
Yeah, right. So his name is Charles. So Tim said, "Oh, well, come on, we can't take him on the program." He said, "What are you doing?"
Well, I always step in here because Rose always. So this first, we gave him the first bottle of drops, and he was a former alcoholic, and we gave him tranquil, and 2 days later, it's 2 weeks supply, he comes back with an empty bottle. I figured he was feeling like shot glasses, And so I said, that's what I said. I don't know if we're going to handle it.
How can we handle him? What are we going to do with him? I said, let's give him another program. Come back in 2 days with the bottle of all that. Let's give him another program. Give him another program. He did a little better. This time he came back a week later. We gave him another program. I said, Tim, let's just give him a month. I mean, see if we can handle it, So he comes back a week later, we give him another program. Then he came back 2 weeks later and another program. Then the next time he came back, Tim said, darn it, we lost him. Because I knew it was going to happen. Because he didn't show up for his appointment. So I said, Tim, just go back out the waiting room. Look around. That's Charles? Can't be Charles. He was there, no pain, looking great, dressed up in a suit, bright, head up, and so Tim kept working with him. And then every once in a while I, have a session with the guy, but he did beautifully.
He was going to his doctor at the Coast Guard. He was a former Coast Guard person. He was going to the doctor, and a lot of these people, and we feel this is kind of good because they go to their independent clinicians, and their clinicians go, hey, it's great, because they think that their medicines are working. But most of these people are not even taking the medicines anymore, but they don't want to tell the doctors this, and so it's making everybody happy,
Oh.
And so, but there was one great program off of that that we ran after we broke through the basics of this case. It turns out it said, what did it say? Some type of ringing in the ears. I think went back to 1944 with this Charles, and he was in the Air Force or Coast Guard or something in India during World War II, and he said he was flying over the Himalaya mountains, and he almost hit another plane, and he heard it. He says, to this day, he says, I can remember the sound of that airplane coming and this trauma, and he says we were crying in the plane. And he says when we used to land after being stacked up for so long over the airfield, they used to give him shots of alcohol, set him up in the air again. And this is beginning probably some of his alcoholism problems. So this story went on, and so the next trauma happened in 1946. I said, well, what's the matter with? He said, I couldn't sleep at night, and I said, well, where did you live? He lived at the flight of coach path of LaGuardia. Okay? And this is the thing you see about the program. You see patterns behind the stage. The next place he lived was another traveler. He was at the right near Bradley Airport in Hartford, Connecticut. The guy kept getting attracted to places where airplanes were. He was just married, you know, when he was at LaGuardia. And he used to jump out of bed in the middle of the night, you know. So, but it was incredible. So, you know, these are potentials like you start running the upper level programs like, you know, audio memory, you know. When you start running these programs with people, I mean, I've had experiences running some of these upper level programs where you can hear the sounds and vibrations coming off, like Joe was saying about the, you know, the transmission of energy. I was running a sense of smell program on a biochemist, an ex-biochemist, and I was turning around looking for the melted plastic in a room. You could smell the vibration coming off the person. It was just, it's just incredible. You feel it there. But this is like a little bit past the SAF, but it is it's quite.
It's there. Well, this Charles, just to go back and just fill you in, he had diabetes. He was on insulin, hypertension, and circulatory problems, and alcoholic. And, you know, within a period, I'd say 6 months, we worked with him. He had no more craving for alcohol. The hypertension stabilized without medication, no more insulin, and the blood sugar normal. And the circulatory problems, that's why he was using the pains, because his leg was so bad, much improved. So he's gone back to the Coast Guard physician, and the Coast Guard physician said, well, whatever you're doing, it's working, keep doing it. But he thought he was still on the insulin and all. Patient by himself, we don't really call them patients, participants we call them. Participant actually lowered his own insulin as he saw his blood sugar stabilizing. And he said to me, at the end of the 6 month period, I wish I had this 30 years ago. But he's not with us now because he has no need to be with us. And he went off on a 6 month trip on a business thing, which he never would have been able to do before this. So we're going to, you know, wait. He'll be back in touch with us at some point, as many of the others have, to tell us that their whole lives have been changed. And, you know, we just feel really good about that.
How long have you had this?
2 years.
2 years.
2 years, but we started about 2 years. Right. Okay, thank you.
That's an interesting phenomenon about the cross-contamination of the chain. I had a lady once who was doing them. In the old days, we used to do them by hand, and she was filling them all out, and she was like correcting everybody's. She would look at it and say, well, are you nervous? And they would put it 2, and she'd say, no, they're really nervous. You know, she'd change it to a 5. That kind of thing. And all the people, seriously, a lot of the people were coming back with menopause. All the change in menopause. And saying, what is this? You know, young, 11-year-old kids, you know. And a lot of the phenomena that you're talking about, so they've been in it a while, you're not familiar with, but or you never even might not see for a while. But what happens is, as soon as you're making these connections, especially in the upper level programs, you'll start feeling what they're feeling because of the transmission of energy. You might, if you're in good enough shape, you'll start seeing it too.